Hello everyone, greetings from Kaushal Clinic, Tobiana Road, Bathinda. I Dr. Bhupinder Kaushal. Today we will talk about a topic on test of a healthy heart. So when we see around, we know at least one person who is a cardiac patient that might be our family friend or a family member. So we all should be aware of the test regularly done for a healthy heart. First one, we should do BP monitoring. BP monitoring is done in two limits. First is the upper limit and second is the lower limit. Upper limit of the blood pressure is the one which is the pressure exerted on the arteries by the blood during the contraction phase of the heart, and lower limit is the one when it is the heart is in relaxation phase. Normal blood pressure of a human being is 120 by 80 millimeter of the mercury. One person will be called hypertensive if the blood pressure is more than 140 by 90 millimeter of the mercury. If he or she is hypertensive, he is more at the risk of cardiac diseases. Second is monitoring of the diabetes. As we know, diabetic is at a more risk of cardiac diseases than a non-diabetic person. For monitoring of the diabetes, one should get tests done like fasting blood sugar, 2-hour postprandial blood sugar and HbA1c. Fasting blood sugar more than 126 mg per deciliter and a 2-hour postprandial blood sugar means 2 hours after food intake. More than 180 mg per deciliter is a diagnostic for diabetes. One is HbA1c test. HbA1c test gives a reading of 3 months average of blood sugar levels and is a good test for screening of the diabetes. HbA1c levels from 5.7 to 6.4% is a pre-diabetic condition, and more than 6.5 or equal to 6.5 is a diagnostic for diabetes. One thing we all should know about diabetes is that in spite of having high blood glucose levels, ones have a low sugar levels for available for the cells. That gives a low energy to the patient. And third is lipid profile, the most common test used to screen the cardiac diseases. You might have listened from the people like मेरा खून गाढ़ा है या मेरा cholesterol check कर दो. Here they mean about the lipid profile. Every people here have a myth like cholesterol is a bad thing that should be not present in the body. But I should tell you that cholesterol is not bad. It should be in the normal limits and it is used to synthesize hormones and steroids in the body. The lipid profile is done to assess the fat metabolism in the body. Lipid profile includes a test like total cholesterol, triglycerides, low density lipoproteins, high density lipoproteins, very low density lipoproteins. You might have also listened about bad cholesterol and a good cholesterol. Good cholesterol is a HDL and bad cholesterol is LDL. Why it is called good cholesterol? Because it takes the fat away from the heart to the liver where it is metabolized. And why LDL and VLDL are called as bad cholesterols? Because they create plaques in the blood vessels which can cause heart diseases also. So you should be aware of normal levels of these lipids in your blood. Total cholesterol should not exceed 200 mg per deciliter in your blood. 201 to 240 can be acceptable or can be regarded as a borderline cholesterol. Triglycerides should not exceed 150 mg per deciliter, and the bad cholesterol, the LDLs, should not exceed 120, restricting 120 mg per deciliter. The good cholesterols, HDL, should not be less than, listen the word, should not be less than, other cholesterols should not exceed, but HDL should not be less than 45 mg per deciliter. Very low density lipoproteins should not exceed 30 mg per deciliters. So lipid test should be done, or all these tests for heart screening should be done at least once in 6 months. And the next test, I think you are not aware of this, that is high sensitive C-reactive proteins. C-reactive protein, you might be aware of this during this COVID situation. But high sensitive C-reactive proteins that are formed by the liver, this is also used to assess heart diseases. And this is a more sensitive than this lipid profile. Normal value of high sensitive C-reactive protein is up to 1. But if you are having values more than 2, then you are at high risk, I think very high risk for heart diseases. So you should also get it checked half yearly or after 1 year. And last is BNP. B-type natriuretic peptide. It is also checked in blood. It is used to check the work done by the heart muscles to perform normal functioning. If BNP is high, it means cardiac muscles are doing more work that is required for normal functioning. It means there is some underlying cardiac disease that should be diagnosed and treated as soon as possible. So at last, I think you got all my points and will get your heart checkup done as soon as possible. Thank you.